Hey everybody, you made it. Final interview of the day. We've got with us Jeff Bernstein, the Director of Results Management, Measurement, and Learning at Path. Welcome, Jeff.
Thank you.
It's great to have you here. So
yeah,
we actually started the day off talking about Path, and we're bringing it all back around. But for the folks who missed the first session there, could you give us a little background on what you guys do and how you use Tableau?
Yeah, sure. So Path is a global health organization. We're based in Seattle. We work in over 70 countries around the world.
Wow.
And we work on basically transformative innovation that's going to really tackle some of the greatest health challenges that are facing us. So one of the things that I have the pleasure of working on is some of our malaria elimination work in Zambia. And so, yeah, we actually started using Tableau as an organization back in 2011.
So a while back, yeah.
Yeah, I mean, for me, that was a while back. And we started using it to actually at an institutional level to help us measure our results across the organization. And it was such a fantastic platform that we started applying it soon after to projects.
Cool.
And then in 2014, as you know from your earlier interviews with Neil, we launched the Visualize No Malaria initiative with the Tableau Foundation. I think we were like either their first or second grant.
Oh, I didn't know that. Oh,
yeah.
Okay. That's really cool.
Yeah, so it was really exciting. And I think at the time we probably couldn't have guessed that we were getting into a pretty special relationship with them, and also just the power of that platform just kept growing, and so it's been so much fun taking it from a piece of software that's set on, a desktop that maybe we had one or two users, and now as an organization we're watching it spread, and partners are starting to pick it up, obviously, but also we are most excited about work that where we get to work shoulder to shoulder, as we do with national governments and ministries of health, and then watch that potential of them start to pick up that tool and start to run with it. So
sure, and some really amazing innovation and actually saving of human lives has come out of this.
Well, I mean, all of this couldn't be possible without the Ministry of Health and the National Malaria Elimination Center that's been developed, and the fact that Zambia has this bold strategy that they're launching to basically eliminate malaria by 2020.
Wow.
And so elimination is where they're stopping all of that local transmission of the disease that's caused by a parasite that's transmitted from person to person through mosquitoes, right?
Gotcha,
So it's really bold. This is a highly endemic country. 14 million people live in Zambia, and they're all basically living at risk of this disease, and so with them being able to take that first step forward towards elimination, we're there as a supporting agency or organization providing technical assistance, and one of the catalytic innovations really is looking to do more with the data, and that's something that the government of Zambia and specifically the Ministry of Health have been focused on, since 2005 when they started really rolling out some of the better malaria control interventions. So universal treatment of universal coverage of bed nets in the country and indoor residual spraying, and using data for decision making even then about where to put resources. And at that time, Path was a partner early in those days to work with them, but and then they've now moved to looking more at their routine data that they're collecting at health facilities.
Okay.
And so sitting on that mountain of information, they've made some incredible choices to now do more with it.
Yeah.
And I think it's right. They're on this, like a lot of the companies that I've met here at the Tableau conference. They're working through that process of building up that analytic capability.
And both you guys and Tableau go and, like you said, work with them shoulder to shoulder to help set these systems up and train them and and bring all that about, right?
Yeah, I mean, with Tableau, what we're doing is they already have a really good data management system that's in place. They use an open source software called DHIS2.
Okay.
And many countries are actually moving to this this platform to collect and store data. They actually have taken another innovative step in Southern Province where they are collecting data in their health facilities using mobile phones. And that's
over there, right?
Yeah, and so that's something that PATH, working with our ministry counterparts, helped introduce. And they've really run with it at this point and starting to collect that information. It's being stored. But now we have, as I said, a mountain of information. So that's where you kind of insert a tool like Tableau that really starts to help you gain better insights. It also is just fun to use, right? And data sometimes can be really tricky and not so fun to deal with.
Fun and data, outside of this conference, seldom go together.
Right, sometimes those are things that are not used in the same sentence. But in this case, I think Tableau, is to data kind of like what Legos was to blocks in some respects, because it's not only fun and interesting around the exploration side, but also from the insights side. And that's kind of interesting. You're kind of combining exploration and explanation in this, as you move through your data set. And so we've really just launched this, right? We launched the initiative, Visualize No Malaria, in 2014, late 2014. We've had a kind of a year run at this point. We're really starting now to get into using this tool, developing prototype dashboards and using them with user groups, right? To really get good feedback and find out what's going to work at all levels in the health system, from the national level all the way down to district and sub-district levels.
Cool.
And so, as when you start to get it right and you start to get those use cases correctly, people really start to respond. But the whole idea is, over time, PATH, really, continues to let the ministry take the lead. And our job is to really find ways to better strengthen capacity so that they can own these tools. And that's where the foundation has been so generous, in terms of providing free licenses. We have a free instance on server, which has been terrific. And it's also led to all of these other incredible partnerships with groups like DataBlick and Mapbox and Slalom and Alteryx and now Twilio and soon Exasol. And so what a leverage point from our perspective, where these are groups that are really interested in kind of putting their tools into the mix and providing them, of course, so that a country can use them, so there is no sort of cost to entry at this point.
Right.
And really helping us iterate quickly on what are the best designs of these dashboards that we're developing. How do we get this data out and back to the people who collected it, creating feedback loops.
Sure.
So, I mean, that's what I was saying in the beginning. We couldn't have guessed that at the beginning of this partnership we would have leveraged, something like almost 10 different companies and more are, already starting to.
What a great stake you put in the ground. That's great.
And I mean, I think it says a lot about the users of Tableau and the companies that, come to not only this type of event, but just in terms of using the platform, the software. There's such zeal around it, and there's also passion to do more than just their normal business, but to actually give back and do good.
Yeah, I understand the Zen Masters have helped out in that respect as well.
Yeah, so it's not only the Zen Masters, it's Tableau volunteers, and so that has been incredible. We're getting all kinds of assistance. Things like just helping us create our internal dashboards and make sure that they're better and more user-friendly, and then folks who are thinking, on the other end of the spectrum about modeling, better mapping techniques, entity extraction. And so these are conversations that sometimes are slow and arduous, but in this case, I feel like with the set of partners that we have, it's they're moving at incredible pace.
Fantastic. So what are some of the cooler interactions that you've had, or
Yeah.
the
I think one of the things that I'm most excited about is something we worked on with Zen Master and Tableau expert Jonathan Drummey in terms of the Viz Alerts.
Okay.
Jonathan works for a group called DataBlick. They've been extremely helpful to us. And one of the keys to making sure that data not only improves and is being used is to create a feedback loop.
Yep.
And so a lot of systems, including many health systems like the one we have in Zambia, is sort of one way. You collect the data and then it kind of gets aggregated and moves up the chain, and decisions are made at the district or provincial or national level.
Sure.
It's very rare, except through supervision visits or sort of special events like data reviews and things like that, where feedback gets back to the individual.
So feedback like, you gave us the right data. Or
You
we
gave
don't
us the
need
right
these
data,
points,
or
we actually did need this, and you gave us something else,
anything
or- okay,
like
got it.
anything from great job to you missed a report to hey, we actually see a reduction in incidents in your area. Can you tell us why? What's going on? This is dramatic, or so I'm oversimplifying a little bit, but right now there are no real good mechanisms to get that information, that two-way communication going.
Gotcha.
So with Viz Alerts, what we have been able to do is start prototyping a simple alert when we miss a report. And so an SMS message is generated through Viz Alerts, as well as an email, and it's sent out at the district and sub-district levels and then to someone's cell phone. And that I should have mentioned earlier, that is also possible because we're partnering with a group called Twilio.
Yep.
That has helped us immensely in getting these SMS messages out.
Yeah.
One of the challenges is paying for airtime, and in a place like Zambia, we might, even in southern province, we could send out 1,000 text messages a month if
Sure.
we had this fully at scale there, and that's a lot of money. And so Twilio has been really helpful in sort of giving us free credit and allowing us the opportunity to sort of hone this a bit and see how it's going to work.
Sure.
So that's an incredible opportunity.
Fantastic.
And it makes someone like Jonathan just so much more effective when they're working with us. And then it was one of the use cases when we went out to Zambia and one of our last trips, working with district health information officers and malaria focal points, is the people in charge of managing the disease essentially at the district level. This is one of the use cases that they really were excited about. We hadn't even thought that really pushing those SMS messages out was kind of a priority yet.
Gotcha.
And they kind of moved right to that, and they pushed it, and they're going to get it. So
that's why there's a lot of talk of introducing technology to African countries, communities, and we take technology so for granted, right? It's all part of our life. We're almost trying to get away from it, and they embrace it, and they can in some ways leapfrog over us. Have you seen much of that, or?
Well, we see. I mean, my experience in Zambia, and I'm based out of Nairobi in Kenya.
Okay.
And my feeling is that the absorptive capacity is immense for technology, and I
Especially
look
with a goal like that in mind.
Yeah.
Right? They're going to stretch the capabilities of it every which direction, and
there's less obstacles too.
Yeah.
So we see mobile money, for example, just going crazy in places like Kenya and other countries, and I mean that says a lot. Like they were there before we were in many respects. So there's a thirst for it because there's a level of access that they're getting that wasn't available before. So.
Absolutely. Yeah. And so you gave a session, I forgot to ask you, was that already delivered, or?
Yeah.
Cool. And the title was Supporting Eradicating
Elimination.
Malaria. Elimination of malaria in Zambia by 2020.
Yeah.
Cool.
So that's the strategy that the Zambian Ministry of Health, Zambian government is putting forth to eliminate malaria. I mean, the correction between elimination and eradication is worth mentioning.
Sure.
We've actually only eradicated one disease.
Really?
Yeah, it's smallpox.
Smallpox. Okay.
Yeah. And so when we talk about elimination, we're really talking about driving transmission to zero in a geographic area.
Gotcha.
And so in this case, the geographic area is in Zambia. But it's a common mistake, but it's worth mentioning because it is still such a bold goal to get
Yeah,
to.
Americans like to, especially in our promotion and stuff. Cool.
Yeah.
So, what are some of the big reasons that you came here? What are you hoping to get out of the conference?
Well, this is only my second time at the conference. I think I get perspective, frankly. There aren't I don't see a lot of global health organizations represented here, and we do get such great access to not only Tableau but also the private sector partners. Mm-hmm. And they're doing some really interesting things. We also find that sometimes we're doing some things, that are a lot of interest to them. So yeah, I think, a lot of what drives me is just learning. And so, coming here, hearing anything from the keynote to any number of sessions is going to open my eyes to a variety of possibilities. And some of it's always going to be over my head, but some of it is very practical and can be used in low resource settings, like the ones that we work in.
So what were some of the light bulbs that clicked off in your head when you heard the keynote yesterday? That would be really powerful.
Yeah, I just think that the platform is just going to get easier and easier to use. I think one of the things that was said to me, or that I overheard that really resonated, was being able to work at the speed of thought. I think was the language that was used, and that just it sort of sent a chill up my spine, because I was like, it's exactly right. We were joking, a few of us, like, yeah, we're trying to figure something out sometimes, in any piece of software, Tableau included, and you spend so much time trying to figure out the technicalities of what you're doing, then you forget what you're doing, and so I think it's just so smart that they've identified that as a barrier, because you want people to just be able to nimbly use any application, any platform, so that it's just like writing, you're just putting
or speaking.
Or
That's
speaking.
almost what they're moving to.
Yeah, exactly. So that's exciting to me. More specifically, the stuff, mapping and maps, since the birth of epidemiology, maps have been so critical.
Gotcha. And
I think what these guys are doing in terms of the ability to, quickly map data points and create shape files and blend the two together, and where 10.1 is going, that's pretty cool.
It's almost the saying, good technology is indistinguishable from magic.
Yeah. It sometimes does feel like magic, for sure, but it's really powerful, and most importantly, you don't want to get caught up in sort of the shininess of a tool and lose sight of the practicality, and so that I get excited when I'm like, oh, I see this mapping capability starting to come online. It's much easier to use, and then you start to see like all the barriers to entry for folks who may have not had, maybe they're just still using Excel,
Sure.
And that's where it starts to get really powerful.
Very cool.
Yeah.
So Jeff, you work hard. Are you going to play tonight?
I actually have a number of calls to do, so I think I'm going to be one of the boring people who unfortunately has to keep going with his day job at night.
Yeah, and you're still on. Your night is their day, and vice versa, right?
There's
so
a little bit.
You don't get to sleep.
There's a little bit of jet lag still, but that's okay. That's what we signed up for.
Jeff, thank you so much for being with us.
Yeah, pleasure. Yep.
I'm jealous. You got a great job, great cause.
Yeah, don't I know it?
All the best.
Yeah, appreciate it.
Fantastic.
Okay,
cool.
Thank you.
Yep. Gang, thanks so much for joining us. This is our last of the day, and we will see you at the party tonight.